group of doctors looked at the 8 fastest rising cancers in young Americans. That means Americans under the age of 50. And they found that the rate of incidence has doubled in those cancers since 1992. But mortality rates have largely remained the same. Only 2 of them, in colorectal cancer and uterine cancer, have had increase in deaths. So more Americans are being diagnosed with cancer, but that doesn't mean more Americans are dying of cancer. In fact, in some cancers, it's the opposite. Breast cancer, for example, it's the most common early onset cancer, but mortality has decreased by about half for breast cancer. So the authors of this study say we've gotten really good at catching cancer early thanks to routine screening, and treatment options have improved as well, leading to fewer deaths. So are the rising cases an example of good news camouflaged as a crisis, or is something else going on? Joining me now is Dr. H. Gilbert Welch. He's a senior investigator at the Center for Surgery and Public Health at Mass General Brigham Hospital. He's also a co-author of this new study. Thanks for being here. So you and your co-authors wrote that overall the rise in cancer seems to be less an epidemic of disease and more an epidemic of diagnosis.
That's correct, Elizabeth, and thank you for having me. And I think it's really important for the public and the news media to be more cautious in interpreting rising rates of incidence, rising number of new cases. It may mean there's more disease out there, or it may reflect changes in diagnostic practice, that as we look harder for early forms of cancer, we tend to find more. And perhaps the most dramatic example of that has been in thyroid cancer, where, if we look hard enough, a whole lot of people have thyroid cancer. But most of those cancers are not destined to ever cause patients any problems. And let me just share with you the most egregious example in the world. Around the year 2000, the government of South Korea started a national screening program, and they started it for breast, colon, and stomach cancer. Doctors added on a simple test, a handheld ultrasound, for maybe $30 or $40 to check people's thyroid. 10 years later, the number of thyroid cancer cases had increased 15-fold.
Wow.
And yeah, it's like, what? And those people were treated, and it became the most common cancer in Korea. What was once a very rare cancer became a very common cancer.
Well, what would have happened to those people if they hadn't caught it?
The death rate didn't change. The death rate from thyroid cancer didn't change. That's the most egregious example. It's the most dramatic, but it just shows you that diagnostic practice can influence the number of cases we find. It's not like it's outside of medicine. How doctors practice, how often people are tested,
right,
what our diagnostic thresholds are, and how intensively our machines can find small abnormalities.
There was a fascinating article recently in The Atlantic by the doctor who wrote The Emperor of All Maladies, which was a Pulitzer Prize-winning book on cancer. He made the argument that this early diagnosis thing isn't sometimes a very good thing. That, for example, in thyroid cancer, it rarely spreads, it rarely kills, and yet people will then go get chemo and get surgery, and that people are more anxious, and that, I mean, I found reading the article, I was like, heck no, I want to know if I have cancer, but it was an interest. I'm curious what your take on this is. Are we over-testing for cancer?
Yes, I think we are. I think, honestly, we are over-testing for cancer. I want to be clear, people get the good news. First, if you have symptoms, come see your doctor. Let us evaluate it. That's really important. But this idea that I think is taking more and more hold is that somehow we can test ourselves to health. That if we just get scanned enough, get enough genetic information, we will be healthier.
Yeah, it's the control freak in us.
Yeah, unfortunately, that's a recipe actually to become a patient quite quickly, and lead to things that I would not consider healthy. Worry, anxiety, appointments,
biopsies,
cycles, biopsies, and all that. So I want to leave people with you're sick, please see your doctor.
Thank you for watching. Subscribe below and download our NewsNation app right now on your phone, and you will get fact-based, unbiased news for all Americans.